So I'm pleased to turn it over to our moderator tonight, Filmstream's board member and assistant professor of psychiatry at UNMC, Dr. Soonjo Hwang.
Hi, how are you? So why don't you guys start with introducing yourselves and go from there.
My name's Waishali Feitak. I'm a neuropsychologist and an associate professor in the Department of Neurological Sciences at UNMC.
And I'm Dave Warren. I'm an assistant professor also in the Department of Neurological Sciences at UNMC.
So I want to start actually with my own experience with this movie. I have seen this one 5 years ago. That was like the last time I've seen it. I don't remember anything about the ending. So that was quite interesting. I thought that they were not told or learned that they were the patients of these doctor. So that part, as I was watching it, was I didn't remember that at all, and it's about the memory. So that was an interesting part. I want to start with David. So I know that you're a neuroscientist actually working quite the opposite of the movie, right? So your project is about enhancing memories in patients, am I correct? So maybe you can talk a little bit about your work and then your thoughts on the movie related to your work.
Absolutely, I'd love to. Thank you for the invitation to talk about my work a little bit. So. Soonjo's exactly right. I study memory. I've been studying memory probably for 15 years now. I got my start at University of Illinois at Urbana-Champaign, working with Neil Cohen, who studied memory extensively for decades. He's a prominent theorist in the field. And then I worked at University of Iowa as a postdoc with Daniel Trunnell, who's a really prominent neuropsychologist. Then I was lucky enough to get a job here at UNMC in Omaha. Some of the current projects that we're working on, exactly as Soonjo was saying, take some of what we think we know about memory based on cognitive neuroscience investigations over the last few decades and try to improve memory in some really novel ways. So one of the projects we're working on currently uses a combination of techniques, some of which were depicted in the movie here, actually. We use functional and structural neuroimaging, combined with a form of non-invasive brain stimulation with the goal of upregulating, of tuning up certain brain networks with the goal of enhancing memory performance. This is something that's been demonstrated in healthy young adults. A friend and co-author of mine, Joel Voss at Northwestern University in Chicago, has done work exactly along these lines, and we are hoping to first replicate some of his work and then extend it. Healthy young adults maybe don't need quite the help with memory that this technique could provide, but it's been demonstrated. A more exciting possibility, I think, is maybe healthy older adults, or prominently, people with pathological memory problems, people with dementia, people with Alzheimer's disease. And so that's where we're going. First, replicate the approach in healthy young adults, and then extend to healthy older adults, and then older adults with the earliest stages of pathological memory changes, amnestic, mild cognitive impairment. So it's a really exciting technique. It's individually targeted. It's a converging methods approach. It combines imaging and stimulation. We're very excited about it. We're starting that work up in the next couple of weeks here, actually. So,
and it does include the dancing around the patient naked.
That is not part of our protocol, but I'm intrigued.
And so what's your thoughts on the movie?
This is a terrific movie. I had not seen it, I think maybe since it was in theaters way back, so I guess that'd be 15 years ago now. It's exciting to see it again. Brilliant script, terrific performances, and it's all about my favorite thing, which is memory. I could talk for hours here, probably. I'm sure any of us here could probably talk about our favorite topics. It's a fascinating depiction of these moments. Our memories aren't organized like a videotape that proceeds at a steady pace. What we see as Joel's memories are being erased, he's moving through them backwards, but we see moments, we see episodes, we see indistinct memories, we see memories from different perspectives. We see how fragile memories are. We see that memories change as we recall them. We see blanks filled in. We see holes. We see faces that we can't remember anymore. it's a fascinating depiction of, you know, healthy memory. It's a fascinating depiction of how memory might be disrupted serially. You know, if there was such a technology, how might you target it? How would you find it in the brain? How would you disrupt it? Which is the kind of the opposite, exactly as Sunjay was saying, the opposite of the goal of some of my current work, but perhaps a necessary one. Here we see traumas visited upon people by you know, relationships. There's maybe nothing more potentially traumatizing than a close relationship gone bad. People do want to forget things sometimes. Post-traumatic stress disorder, to some extent, is about a painful experience that can't be forgotten. What if we could help? And so this movie explores that. It's funny, it's poignant, it's very personal, but it's something that other researchers are working on. How do you disrupt a memory when it's so painful that you want to forget it? So it's a great movie, and I really enjoyed seeing it again.
Yeah, and Vishali, I understand that you've been working with a lot of patients who struggle with their memory, like Alzheimer's patients, and they have an identity crisis because, you know, they're losing their memory. So can you tell us a little bit about your work and also your thoughts on the movie as well?
Sure. Thank you for inviting me as well. I have not seen this movie before. I agreed to talk about this because I love talking about memory, and this is a very nuanced and kind of wonderfully layered depiction of memory that was great to see, and I think closer to what we know about theories of memory. So as Sunjo said, I work with testing patients who have neurological disorders such as suspected Alzheimer's disease, Parkinson's disease, MS. There are a number of neurological diseases that we know can affect cognitive function. We also know systemic diseases, so it's not just neurological diseases that cause cognitive difficulties, but for example, liver failure can cause a hepatic encephalopathy. And so I see a variety of people, and we do cognitive testing to look at the deficits that they're having in memory and other cognitive areas that might be explained by the disease process itself. But often you have different factors playing into it. One of the great things I really enjoyed about this movie was that it combined emotions or emotional memories along with some of the factual, or at least the perceived way the situation happened or the episode happened. So our memories aren't stored in a sterile environment. They also include how we felt during that situation. It also includes how we might be feeling when we retrieve the information. So memories can be, when they're encoded, new memories are made, but when they're retrieved, they can be reconsolidated, and memories are not set in stone. They can be changed, and the retrieval process itself can affect memory. So I really enjoyed the portrayal in the movie of that kind of delicate nature.
Thanks. One thing really stood out to me is that as Joel's memory is being erased, I mean, he really freaks out because he's losing his identity as well. As you're working with your patients, you know, do you see that kind of parallel? You know, say for Alzheimer's patients, you know, as they're losing their memory, what's their emotional response to it?
Right. So unlike in the movie where they chose to have their memory erased, I mostly work with people where they're having disease process where this is happening to them. So involuntarily they're having their memories perhaps erased. And that creates quite a crisis in terms of if people are forgetting other familiar people's names, kind of like how Joel was seeing that his memories of Clementine, even though he wanted them erased, in the middle suddenly started to realize how important that relationship was to who he was. So a part of his identity is the experiences he had, even if they were difficult experiences, traumatic experiences. That was part of who he was, both emotionally and his life experiences. And so some of the patients I work with who have Alzheimer's, often talk and very poignantly about a loss of self. And we will see the grief process both in the patients who are losing their memory and their family members, because they're losing a sense of self during this loss of memory process.
I think it's always good to have it conversational, so maybe it's about a time we can take some comments and questions from the audience.
Are we on? We must be. The way that the memories and their retrieval were conveyed in this movie made me wonder, is this more representative, in your opinion, of the type of memory loss associated with Alzheimer's or other dementias versus the memory gaps that are part of dissociation? Because those are two different mechanics, right?
Maybe you can address it?
So the movie's depictions of how memories are physically organized in the brain is depicted, I noticed, on a second viewing and with a little bit more experience. The movie depicts memories as being distributed around the brain, which is exactly right. That is our sort of modern understanding. There are certain parts of the brain that are critically important for making new memories, for retrieving old memories, but we do now understand, I think, that most memories are stored in a distributed fashion, and so when they're chasing memories physically through different parts of Joel's brain, there's a kernel of truth to that. Memories are stored in a distributed way. The progression of a disease like Alzheimer's with incremental development over time of plaques and tangles is thought to sort of incrementally interrupt those circuits to some extent, with an increased burden in certain parts of the brain, interrupting memory functions over time. Dissociation is a fascinating, dissociative fugues and so on are a fascinating form of memory loss that seem to be, they might be characterized differently. It's less of a physical disruption of those circuits, and maybe more of a functional disruption, a temporary change in those circuits that can be reversed, versus a physical change, as we understand it at least, a pathological change that we see in Alzheimer's disease, which is currently, the best medical science cannot reverse that. So,
yeah, the dissociation question is kind of interesting because, actually, memory doesn't work like the movie. I mean, you can't just dissect, the specific part and then just take it out. But dissociation is probably closer to that, because, they'll lose, certain parts of the memory very kind of sharp demarcated. So in that sense, it might be kind of, closer to, dissociation, patients with dissociation.
On the other hand, I thought it also showed closer to Alzheimer's in that Alzheimer's disease starts with loss of recent memories and then it works backwards. So your remote memories are better preserved in early stages of Alzheimer's, which is kind of the progression they showed here, which is also true with like a traumatic brain injury where you tend to lose the memories around the time of the accident or the brain injury, and your distant memories are more preserved. So that part was similar to.
I was taken initially with the thought of the trust in the doctor and that relationship, the patient-physician relationship that seemed so curious. And then only to have him, having a coworker as well. So, and then the thought of Frankenstein, or Dr. Frankenstein, little, young Frankenstein. The absurdity of, the cap and so I don't know. actual infliction maybe of this treatment. So I can speak to the patient-doctor relationship a bit about this and trust.
So that's a very good question about the ethics, and at one point, they did bring up the word, this is not ethical, but then they went on to do further. So it was just addressed. Certainly the doctor-patient relationship is very important, and that's why all specialties have code of ethics, and it's important to follow those code of ethics. And that actually trust you're putting, especially when he's under and he decides to change his mind. So the neuropsychological testing that we do, it's an elective procedure. They're giving consent to do it, which we go through the consent process when somebody comes into the office. They're agreeing to go through this procedure. And then part of the consent process is that they can actually stop at any time. They don't have to give us a reason why they're stopping, in fact, because it's a consent process that they can withdraw at any time. And that's just a part of trust building that we talk with people ahead of time.
I guess, that's one part maybe kind of tricky about this movie or many other movies out there is that, maybe David, you can address it. Because, when you think about research and experimentation, it's just like what the work what you do. A lot of times, people's mind go to something like this, like sort of like unethical kind of exploitation of the patients. And, so there's some kind of hesitation to participate, and maybe you can talk a little bit about it.
Sure. So when we conduct research, exactly as Vaishali was saying, we go out of our way. First, we have to convince not participants. First, we have to convince a board, an institutional review board, that what we're doing is ethical. And that includes all kinds of considerations. They make sure what we're doing is safe. They make sure that what we're doing is non-coercive. They make sure that we're going to educate patients, participants, before we do research. This is all coming out of work decades ago because of concerns that arose in psychology, actually, over how experiments were being conducted back when things were a little wilder, maybe. Maybe some folks in the audience have heard of the Milgram experiments or the Stanford prison experiment or things like that. And it dates back even farther in the post-World War II era. There was a lot of work to make sure that research with human subjects was conducted in a way that was humane and that benefited, if not the individuals who were participating, at least society writ large. So, we do work with individuals. One of the important things in working with memory-impaired populations, when we're conducting research with memory-impaired populations, is understanding that their decisional capacity may be impaired. They may not even be in a position to evaluate whether they want to participate in this research, whether it would be beneficial to them. In cases like that, we evaluate their decision-making capacity, and in some cases, we ask someone else, a caregiver, someone who does have an intact decisional capacity, to help that person decide whether or not they should consent to be in an experiment. And then we also obtain the assent of the individual who will be participating, him or herself. So lots of considerations, but every research study that you might be interested in participating in at UNMC or UNO, any institution in town here or anywhere in the US, in fact, will have been thoroughly, believe me, very thoroughly vetted by your local IRB before you would ever be looking at a consent form or talking to a researcher.
Isn't the biggest reason for the dispersal of various parts of a memory to different areas of the brain largely due to the fact that all multiple senses are involved in that memory and your senses are controlled by different areas of the brain?
So that's a really important point, I think, and that's something that's been appreciated relatively recently. This idea that the parts of the brain that process information initially may be important for storing that information in a durable form long term. So when you think about an episode, there's sights and sounds and smells, emotions, and all kinds of other information that comprise that episode. And those individual traces of those experiences do seem, we think, to reside in those cortices that are processing them initially. Auditory cortex for sounds, visual cortex for visual information. What's critical for a memory is to bind together all of those things that happen simultaneously. And there are special parts of the brain that seem to help us do that. One of them is located deep in the middle part of your brain, in the medial temporal lobes. It's called the hippocampus. It looks kind of like a seahorse, or did to neuroanatomists way back. So they named it for exactly that property. And the theory that my graduate mentor, Neil Cohen, developed with Howard Eichenbaum, relational memory theory, is exactly about this idea that part of your brain, the hippocampus, binds together the unique components of an experience in a way that allows those discrete percepts to be linked. And then any of those unique percepts experienced again can retrieve that entire memory. So we saw the folks at Lacuna hunting down, telling Julie, oh, you have to bring in everything that was connected to Clementine, because any unfamiliar element in your apartment could spark a memory of her, could bring this whole memory back. That's an example of relational memory. If seeing one of those potatoes dressed up is enough to spark Joel's memory of Clementine, that's a relational memory.
Hard to forget.
Linked. Exactly. Impossible. But that's an example of a relational memory where a single cue is enough to retrieve an entire memory.
Well, I have a follow-up question for both of you. So I think the important part is that the memory is just not the information. I mean, it's strongly attached to emotion, and I think the movie shows actually pretty well. It's harder to erase. It's the higher valence the memory has in terms of emotional, the content. So maybe you can make some comments on that.
It was interesting in the movie how even when Clementine couldn't remember the memories or the episodes that happened, she had a sense of discomfort that something was missing, even if she couldn't voice that something was missing. So that emotional memory wasn't fully gone, even when you didn't fully understand what was going on. And when people are pretty in a state of advanced dementia, we counsel family members that they may not have the words to express themselves because their language has become so impaired, expressive language, where they can't express what they are trying to say. But the emotion that they're feeling is still real, whether it's anxiety because of darkness or unfamiliarity. The emotion is still real, and it's important to address the emotion or react to the emotion, even if they don't have the words to say that anymore.
Or even just the frustration of not being able to express it.
Yeah, absolutely. And we absolutely see that.
So I know we kind of talked about like the patient provider, patient researcher ethics, but like if this kind of clinic existed, do you think it would be an ethical thing to actually go through? Like where's the line? Like how bad of a memory would it have to be for you to be like, I want to erase it?
Well, that's a really good one. Yeah, who's gonna take on this one?
Volunteer our friendly psychiatrist discussing.
Well, I'm a moderator, but actually that's a really interesting question because when you think about it, that's what we do a lot as a psychiatrist. PTSD is the extreme case that we want to actually modify or erase the memory they have about their traumatic event, but in many other psychiatric disorders, we do the exactly same thing, like anxiety or depression. We're basically modifying their memory so that they can function better. Where's the line to it? I mean, I think I'm a very pragmatic person, so I'll say that it's beneficial to them. That we just go for it. But that's the question we have to kind of tackle every day, because the other interesting part, actually pertaining to that question, is that as you see, I mean, the Mary character as well as two main characters, they repeat their pattern, and it could be dysfunctional in their life. And do you really want to change it? I mean, it's really romantic, cute relationship, right? But they just keep doing it. And as a psychiatrist, I may see that as a problem, then I may want to change it, right? So that actually brings up a lot of questions there too. So I mean, I don't have a good answer. I'm just answering your questions with questions. So.
Yeah, I'm not sure that there's a definitive answer either, except it was mentioned that Clementine made an impulsive decision to that she was in pain, and it seemed a lot of people went to that clinic in pain and wanted their memory erased. And certainly PTSD is an understandable condition where people are in pain and they need that trauma reduced to where it's a manageable amount. But as a provider, I would want to discuss whether somebody's doing this impulsively, like, oh, I want this guy forgotten, so let me just go into this clinic and have it erased. I would want to have a longer discussion to hook you up to a machine.
We have another question right up top.
You talk about a lot about PTSD and everything up there, and I was just kind of wondering what like a flashback is kind of like. How does that bring on and stuff like that? Because they can be pretty serious, and the person feels like they're kind of back in that moment. Is that a memory, or how does that work? Or does it work like a memory?
Yeah, that is a good question. So I would argue that yes, it is a memory. It's a memory that is extremely potent. I think everyone probably has, regardless, I won't guess whether anyone in the audience has experienced PTSD, but everyone has salient, highly emotional memories that they can call up that may be, they may be positive, they may be negative, they may be terrifying. There are all kinds of different memories. I think the key with PTSD is that it's pathological and it's irrepressible. It's something that the person cannot deal with, cannot manage with sort of typical what we would expect from a typical healthy adult. But yeah, in terms of the intensity and the quality of it, I think that, yeah, it's a memory. It's a pathologically salient, powerful memory.
Interesting enough, I want to hear your comments on that too, including flashbacks. The neuroscience nowadays are finding out more and more that how kind of inaccurate or confabulating those memories can be. I mean, the things you remember as really intense moments or whatnot, when you actually look at the literature nowadays, it's pretty clear that, the validity can be really questioned, can be.
Yeah, so this is a great question. So so everyone has a memory, and I'll pick an example that I hope doesn't traumatize anyone, but 9/11 is for those of us who are here, who are old enough, 9/11 is something where everyone knows where they were when they heard. For my parents' generation, it was the assassination of JFK. Every generation has moments, socially important moments, when you know where you were. Interestingly, psychologists, cognitive and social psychologists, have taken advantage of some of these moments. It sounds morbid, but they've taken advantage of some of these moments with pre-existing experimental designs deployed in the wake of events like this, specifically to study the quality of the memory that results, because everyone has a memory of where they were on 9/11. How accurate are those memories? They're called flashbulb memories because they seem to be these memories that are special, privileged, that are intact, that do not degrade. Is that the case? And it's not, it turns out. This is not to impugn anyone's memory of what happened on 9/11 at all, but it has been demonstrated empirically that those memories are as susceptible to disruption, degradation, change, modification over time as any other memory. The key difference is that everyone has one. Everyone has a memory for that moment because it's been asked about, it's been called up lots and lots, but that doesn't protect it, it turns out. In fact, there's some evidence that says that the more we interact with the memory trace, the more susceptible it is to disruption. But again, this seems confounding because everyone has that memory. It probably seems very rich and very real, very salient, but that memory is just as likely to be at least partly constructed as it is to be true. And that's a funny characteristic that just demonstrates how, again, fragile and immodifiable memory is.
Thank you guys for agreeing to come and answer our questions for our enrichment. And I'm aware you're all intimately familiar with disease pathologies as a result of your practice or your research. Tom Wilkinson's character, Dr. Mierzwiak, casually mentions that the procedure is brain damage. Purely as a matter of speculation, what would be an effective way to induce localized brain damage such that you could target specific memories? Again, just feel free to use science fiction as a crutch to rely on, given that this is what we're talking about.
So the truth is that targeting individual memories would be really, really hard. It's beyond what we can do now, and maybe that's good. Maybe it'll always be beyond us, and maybe that's good too. I would say that our best understanding of how memories are stored, as I was saying when I responded to somebody else's question earlier, is that they're distributed. And when we say distributed, they're distributed across brain regions, and that's true. The trace of a memory, the physical trace of a memory, as best we understand it, is in a change in the weights of connections between neurons. That's our best current understanding, is that individual brain cells that link to one another have some kind of modifiable change in brain structure that is a residue, is a trace of that memory. So how do you disrupt an individual memory, like an individual experience or something like that? You would have to, if you were doing it physically, you would have to get in there and manipulate the weights of the connections between different brain cells. There is some fascinating work going on in this. If you go home and you Google engram cells, Thomas Ryan and other folks are doing some fascinating work in animal models with optogenetics and all kinds of really sophisticated technology, protein synthesis inhibitors, just really fascinating work. I don't want to go into it, but essentially they can suppress a memory, they can make an animal amnesic for an experience, and then they can bring that memory back by shining light on the brain and activating new brain cells. It's fascinating work. It's getting toward what you're talking about, and it's really interesting. There are other work. I would argue that functional changes in specific memories are exactly the kind of thing that people might try to pursue when they're trying to treat a patient who has PTSD or something like that. And so you can work with the brain, you can use the brain and cognitive processes to try and change and erode memories as well. And that's, you could argue that that's a sort of a built-in mechanism for changing a memory that doesn't require this kind of extraordinary science fiction kind of intervention. So there are lots of routes. It doesn't have to be science fiction to change a memory, but we'll see, maybe we'll get there.
Maybe professionally make some comments on the stereotactic surgery. It doesn't change the memory, but change the repetitive behavior.
So there's surgery related to temporal lobe epilepsy. Temporal lobe, medial temporal lobe, we talked about as being involved in memory functioning. And in adult onset epilepsy, it's a very common area for epilepsy that's not treated with medications. And so these patients often have to undergo surgery because their seizures are so debilitating that continued seizures itself could put them at risk for physical injury, but repeated brain injury as well, because they're having such frequent seizures. And so they might go through a resection of the temporal lobe, which forms new memory. So they're at risk. So that's causing brain trauma because you're resecting the temporal lobe. A brain tumor in the temporal lobe is another reason why you may take out the temporal lobe. And in fact, what we know about temporal lobe involvement in memory came from an epilepsy patient who underwent bilateral or surgery on both sides of his temporal lobe and became significantly amnestic. HM, you might have heard of him, and he contributed to the science and our understanding of temporal lobe involvement in epilepsy.
And speaking of the stereotactic surgery, one area I can think of, especially in psychiatry, is the stereotactic surgery for coordinate. There's something called the striatum in the deeper structure of the brain. And for the patients with a severe obsessive compulsive disorder, there's a surgery just to target and then destroy that area by radiation. And it doesn't change the memory, but it makes them better in their repetitive behavior. So.
Similarly, ECT or electroconvulsive therapy also has known side effects of memory, but it's done to treat intractable depression or bipolar.
Thank you. Along the lines of modification, he started in the movie kind of interacting with Clementine, and they're talking about losing their memory, which was a little surreal. But I think of other movies like Memento, where you start to remember things the way you want to remember them, and I don't know if that's possible. Like, you talked about the 9/11 and how people start to kind of tell themselves, for lack of better terms, half-truths about what they believe happened and didn't. And so is there, maybe it's a psychology thing, but where you can get to the point where you convince a patient or a person that these negative memories had a positive effect, and therefore they have more of a Pollyanna or optimistic view on things, and they're removing that tragedy and seeing it as a crutch to better things. I don't know if that's a question or just stumbling here, but I would like your guys' thoughts on that.
Yes, and that's what makes memories less discrete, because there is a way of modifying memories. We have a way of internally modifying memories, and they keep changing. We can find comfort in our own memories, reduce the valence, the threat, perhaps, and remember only aspects of it and not realize that we're doing it. There was also, so towards that, to understand what parts of our memory needs to be suppressed or made it flipped into positive, we also have a concept called meta-memory, which is knowing what you know. And so there's parts of our brain which also keeps track of that. And that was kind of depicted with Joel, where he is saying, no, I'm going to forget this. So let's, so that to me reminded me of the concept of meta-memory.
Well, I think, basically, as a psychiatrist, what I can tell you is that if you think about concept of yourself is a kind of collection of memories of yourself, then, what the therapists do is basically that, changing your concept. So maybe you can selectively remember better about positive attributes of yourself and forgetting about negative attributes of yourself. And maybe same with the important people in your life. If you're in couple therapy, basically what the people do is that you enhance their memory towards others of positive things and forget about the negative things. So when you think about it, I think that's probably all the therapists do every day.
I think we have time for one last question. Is that right?
Thank you for your time and for answering the questions that we have. I'm curious, as we talk about memory, and we focus a lot on recalling or losing memory, but I'm wondering, as we wander through life on a day-by-day basis, what can we do as people to maybe form stronger memories of the experiences that we're having at the time? Is there something we can do that builds those memories where they're going to last, or they're more able to be recalled, they're richer memories? There's something that we can practice or try to do to have memories that are going to last as we age?
So great question, and this will come around to what you were talking about, enhancing memory. We know with aging that there is a normal part of aging where some amount of forgetfulness happens. And so there are a number of techniques that have been found helpful, just simple rehearsal. So practicing the same information. But obviously, rote rehearsal is not the best form of remembering things. And you don't want to remember everything, like you don't want to remember your dry cleaning ticket number. So prioritizing what you want to remember is important as well. We live in an age of information, and I think educational techniques of where they were far more memorization based has now changed because search engines are so widely available and we have mobile devices, and so we don't have to remember things as much. And that's can be used not just as a crutch, but actually compensatory device, and maybe even to beef up your memory on at times.
Correct me if I'm wrong, but I think basic things really matter, like exercise every day,
Yes.
eating well,
Yes.
don't get drunk too much.
Alcohol does affect. So one of the things like where perhaps cardiology and neurology might disagree is that glass of wine a day that cardiologists kind of recommend. I don't know that it's as good for your brain.
Well, they have tough lives, so.
So yes, physical exercise by far, behavioral technique has been shown to be beneficial for overall cognitive health. Heart healthy diet has been is good for brain health as well, and sleep. Memory consolidation happens during sleep, so getting restful sleep is useful.
Yeah, I think that's all, that's important advice, and I know it sounds, everyone probably scolds you about exercising more and getting regular sleep. It's the same advice for any cognitive domain, it turns out. What's good for your body is what is good for your brain. Nutrition, sleep, and exercise are good for you. Remember, your mind arises from your brain, right? So what's good for your body is indeed good for the mind as well. In terms of improving day-to-day memory, there are lots of different mnemonic techniques. If you're interested in being able to remember people's names better, if you're interested in being able to remember lists of items, we've known about a variety of really effective mnemonic techniques, the method of loci, there are a whole variety of them that date back to ancient times. Cicero wrote about some of these in histories of the Roman Republic and in his own writings. They're very effective. Mobilizing spatial memory to help you remember things is extremely effective. Nowadays, we don't really need to remember as much, exactly as what Shelley was saying. We have devices, we have phones, and we have computers that can help us remember things. That's great. Don't disregard the power of an external memory device. If you really need to remember something, as Neil would say, you put it on your calendar. Or if you need to, remember to bring something with you to work, you put it by the door. Use your environment to your advantage to help remember things, and that's fine. In terms of improving and enhancing memory, we are looking at a variety of what might seem like radical science fiction kinds of approaches that can potentiate memory. Non-invasive brain stimulation is one of those. Invasive brain stimulation is another. There's some really interesting work going on once you have electrodes on the brain for the kind of recording that you might do before you did brain surgery, the main brain surgery like a resection. Once you have electrodes on the brain, you can do some really interesting work to try and figure out what the pattern of a successful memory looks like, and then maybe intervene if a memory looks like it's going to be not so successful. That work is going on now in humans. There's a lot of work going on in non-human models of memory as well. That's, as I was talking about in terms of engram cells and things like that, does seem like pure science fiction, just impossible. But some of the stuff that we're doing now in terms of non-invasive brain stimulation would have seemed like science fiction just 20 years ago. So exercise for now, and hang on, and we'll see what we can do for you in 20 years.
Yeah, and don't get drunk too much. Thanks guys for doing this, and thanks for coming here. Thanks.